PSA testing. Here's how to have the most accurate results to track what is happening with your prostate, prostatitis, or prostate cancer. Let's dive in. PSA testing is very important. Every man should do it after the age of 40. It's very important if you track your prostate, if you have any prostatitis or any enlarged prostate. To track that in combination with free PSA, I have a calculator in my website. But also, if you have prostate cancer and you're either on active surveillance or any cancer treatment, PSA after the diagnosis of prostate cancer sort of like serves as a tool to monitor what happens with the prostate cancer, like a tumor load and what's the activity of the prostate cancer. So making sure nothing else artificially rises your PSA is very important and can drive a lot of clinical decisions. Here's some tips to know on what to be careful of, what to avoid, what to do to make sure you have the most accurate reading every time. First of all, avoid any sexual activity for 48 hours before your test. Any sexual activity can increase PSA levels. That doesn't mean it makes your prostate cancer grow or somehow it causes prostate cancer. It just artificially rises PSA levels. All the blood and mechanical pressure release more PSA to the blood. So that just inflates your PSA levels without meaning that it has any effect on your prostate, any prostate cancer, prostatitis, nothing like that. Now, you must avoid any sexual activity. That is with or without ejaculation, with or without a partner, so even masturbation. And also gay men need to do PSA tests, so any anal sex, any stimulation of the prostate will inflate PSA levels. So avoid any sort of sexual activity with or without a partner or alone or for 48 hours before the test. Number 2, avoid any vigorous exercise for 48 hours before the test. Now, exercise, especially the one that mobilizes big muscle groups, increases your heart rate for prolonged periods of time, will artificially inflate your PSA levels. Again, does that mean it's gonna increase the growth of prostate cancer or increase your prostatitis or make your enlarged prostate even bigger? Nothing like that. Actually, exercise fights prostate cancer and metastasis and everything like that. It's just that the increased blood flowing through the prostate will artificially inflate PSA levels because it causes more of these molecules to release in the blood. Cycling is especially notorious. Not only, again, it increases heart rate and more big muscle groups, but because the saddle is right in the pelvic floor area and it pushes on the prostate with your body weight, and then there is bumps going up and down when you're cycling, that causes a lot of mechanical pressure on the prostate and releases more molecules in the blood. Okay? Studies have shown at around a 10% increase in PSA levels after cycling. That 10% might not seem a lot, but it might trigger your urologist to say, look, your PSA levels went from 4 to 4.4, therefore we need to do a biopsy or change your treatment, okay? And you just cycled. So my recommendation is avoid any vigorous exercise or going to the gym 48 hours. Avoid cycling, running, any long hard walks or hikes, any heavy lifting. Light walking is fine. So you could have your gym session, for example, on a Monday morning, then avoid the gym or any exercise until Wednesday morning when you're having your PSA test, and then right after your blood test, you can go to the gym. If you're finding this useful and you click the like button, it can really wake up the algorithm and get it in front of more people who are going to be educated about those things. And with your like, you can generally make an impact on someone's health decisions and improve their lives. Infections and inflammation. Urinary tract infections, UTIs, prostatitis, or any recent illness can really increase PSA to the range that's seen with cancer. Let's go first with the UTI. UTIs and prostatitis can really increase PSA levels and can really get your urologist to give you a biopsy, for example, when all you had was a UTI. Now, if you had any pain on urination, any burning, any urgency or fever, or you know that you had prostatitis, what you must do, or you had like a diagnosis of a UTI, is you wait until your symptoms fully resolve. From that point, you have to wait 6 weeks to trust the PSA test. Very important to understand, not 6 weeks from the start of the symptoms, no. When the symptoms fully resolve, from that point, you have to wait 6 weeks to be able to do a PSA test and trust it. Okay, it's that long. Number 2 is the acute urinary retention. If you had any episodes of acute urinary retention, especially if you had to put in a catheter, that's when you have to wait to the point that your bladder function normalizes. From that point, you have to wait 2 weeks to be able to do a PSA test and trust it. Okay, so for these things, it takes way longer. Then any systemic inflammation, any sickness, even like if you go and you take the shot, the flu shot or anything like that can increase PSA levels. So basically, if your PSA is unexpectedly high soon after a big systemic illness or any shots, repeating it later under calm conditions is recommended. You need to do it. Don't trust a PSA test soon after a systemic illness or a shot. Prostate procedures and manipulation. Basically anything that directly fiddles with the prostate will increase PSA. Number 1 is a distal rectal examination. If your urologist has done this procedure, you need to wait at least 3 days. There are studies that show that it increases PSA levels. And the other thing is any biopsy, any catheterization, any cystoscopy, any TURP, for example, to trim off the prostate, an enlarged prostate, will increase PSA levels. So anything that involves scopes, catheters, any cutting, either to the prostate or to the bladder neck, will inflate PSA levels, and you have to wait 6 weeks after that procedure to trust a PSA test. Number 5 is medications and hormones that affect PSA. Some of them can lower PSA, others can increase PSA. So what do you need to know? Well, the first big ones are 5-alpha reductase inhibitors. I call them 5-ARIs from now on. Some of those names are finasteride or dutasteride. Some men get them to reduce their prostate size. Others get them to reduce hair loss, which the latter, definitely I don't recommend. There's natural ways to reduce hair loss, but that's a completely other topic. Okay? Continuous use of those for 6 to 12 months even can reduce PSA levels by up to 50%. So there is a clinical guideline that if you have been continuously on these for at least 6 months, you need to double your PSA values of what you get to be able to have a gauge of your actual PSA values. Some medications like statins, non-steroidal anti-inflammatories, any diuretics that are based on thiazide, these can also reduce PSA individually about 10 to 13%, but if you combine these together, you can get a reduction of up to 40% on those. So you need to be careful of those, you need to be aware of those, you need to inform your urologist that you're taking those, and this can have effect on your PSA. They won't be able to know. And what I'm gonna say is basically standardize what you're getting between tests. If you recently shifted your medications, you need to account for that and maybe retest. Another thing, some things that increase PSA would be hormone therapy. So if you're on testosterone replacement therapy, TRT, that will increase your PSA. Does testosterone or taking testosterone increase cancer growth, prostate cancer growth? That's a topic for another video. What I'm gonna say in that video will surprise you. But what I wanna say about this video, this is PSA, that medications can either lower or increase PSA artificially, so you need to be aware of those. Number 6 is supplements, diet, and other lifestyle factors. Let's start with supplements. Biotin supplements, which is vitamin B7, can affect PSA values. They don't actually affect PSA levels in the blood. What they affect is the test. So the labs, when they are doing the test for the PSA, some of them use chemistry. The chemistry of the assay of the basically the analysis is dependent on biotin. So sort of like if you're taking biotin supplements, usually sold for nails or hair, that can influence the lab results in the lab. So it can sabotage the analysis in the lab. So my recommendation is stop these supplements 48 hours before the test. Let the lab know as well that you have been taking specifically biotin. Now, when it comes to diet, there hasn't been any strong evidence that sort of like any specific meals or foods or coffee or alcohol influence PSA levels. The only thing that has been shown is that actually obesity can lower PSA values. That doesn't mean that being obese actually reduces any growth of prostate cancer or the risk of getting prostate cancer, nothing like that. It sort of like artificially lowers PSA values, likely because of hemodilution, okay? So actually if you're obese, you might have prostate cancer and not know it because it sort of like hides the PSA levels. Anyway, that's something to keep in mind. That has been shown that basically obesity can lower artificially PSA levels, so you gotta be mindful of that. But no specific foods or any drinks sort of like alter PSA that much. What I'm gonna say is just avoid any extreme hydration or aggressive fluid loading. Try to keep things consistent between tests. Now, before we jump into the last point, I want to let you know that I offer one-to-one health coaching for men with prostate cancer, helping them succeed in their medical treatments and getting them more effective, reducing their side effects, and helping them fight prostate cancer also naturally through their lifestyle, their nutrition and physiotherapy, exercise, all the lifestyle. We also have a prostate health coaching and support group where I deliver an exclusive lecture to these men in the group. Last group meeting was, can I just take lycopene supplements or do I need to eat tomatoes? The question a lot of you have. I delivered it to the lecture, to the last meeting, and then the men get to know each other, exchange their stories, and also motivate each other to do something with what they have. So that is available. Click the link in the description to go to my website and learn more about that. And the last point is the natural day variation of PSA. Within the same day, your PSA fluctuates naturally, okay? You can literally have a difference within the same day without you doing much or anything of up to 20% in your PSA. That's a lot. So imagine between days. That gives you the importance of trying to keep everything as identical as humanly possible between PSA tests. So basically, what I'm going to recommend is keep it on using the same lab, okay? Because the different labs, the way they process your blood sample, the way they do the analysis might have a little bit of variation. Do it at the same time of each day. And sort of like try to make notes of the 24 hours or maybe, I don't know, the 48 hours before that when it comes to exercise and sexual activity and any symptoms you have. In 40 and basically 24 hours of any, just the food or the sleep that you had, okay, these things might give you a little bit of insight months later. Like, why was the PSA value much higher or much lower compared to the rest? What happened then? What can I avoid the next time? Okay, keep it the same lab, the same time, and as identical as possible. I don't want you to go crazy, but standardizing the conditions between the tests will matter a lot.